everybody. Welcome back to another episode of Tween Sessions with Berries. We have a really interesting guest today. I don't even know everything she does. I'm super excited to dive into this, but let me give you a little intro. Nadine Wilches is a licensed clinical social worker and innovator in preventative mental health approaches and technologies. Driven by an endless desire to improve people's lives, protect vulnerable populations, and strengthen communities, she has led clinical and preventative health programs for over 20 years. Drawing on years of research and interviews, Nadine developed the EQUIP model and 5 elements of Systemic Wellbeing framework, the first comprehensive, evidence-based approach to population mental health. With this, she founded Mind Arch Health and leads the social enterprise as the CEO. Nadine, I'm glad to have you here. I can't wait to hear about everything you do. So if you're okay with that, let's just dive right in. Could you tell us a little bit about you and what you do? I love this idea of preventative mental health. It's so important.
Yeah, well, I'm guessing because many of the listeners on this podcast are therapists, psychiatrists, right? They're in the work of sort of that medical model of treatment and trying to reduce and reverse symptoms, right? That's what a lot of times what we talk about as tertiary prevention. And so since we're talking about prevention today, that's the lens that a lot of these folks are coming from. And that's a lens I was in for 20 years as well. So I think this will resonate a lot with folks is that, over those 20 years, a recurring theme is if we could have only done X before this, these kinds of things wouldn't have presented in this way. Or, we look at the systemic problems and, simple things from transportation to healthcare, access to quality of care and all of those things. And then we start to think about that big picture and say, well, if only these things were stronger, if only these pieces of the puzzle were addressed in different ways, we wouldn't have so many people in crisis to begin with. And so there's this really burning desire for me over the 20 years saying, there are ways we can strengthen the systems, but I can't do it while being in this, kind of crisis intervention mode. And although I wasn't oftentimes, direct patient facing, so I did spend most of those 20 years as a clinical director of programs sort of innovating in terms of improving quality, improving service delivery, supporting clinicians, developing out programs and things like this. So I was always coming from this lens, but in a very reactive way. So I just stepped back from that and decided, okay, I really want to follow this passion. It wasn't as easy as I'm making it sound, though. As an entrepreneur, Aries is, kind of paving the path as well. You all know that it's not as easy as just stepping away from these big roles and trying to do something new. There were a lot of stumbling blocks that we could probably talk about on another podcast. But we got to the place that we want to make these changes. So that's where I was coming from.
I love that. And I imagine in the role that you've had in the clinics and trying to develop these programs out, it's like the system is not built for preventative care, especially like insurance-based or even community mental health-based. It's like definitely they're coming in very acute with a lot of symptoms, and there's not a lot of room or money or insurance coverage for how are we going to do the preventative stuff? Now, I've seen some changes in case management, CPT codes, and those things starting to emerge to help with preventative stuff, but it's just not built into our system. So I just wonder, you probably had a huge challenge even with that. How do we pay for this? How do we do this? I would just love to talk about all aspects of it. You see the problem. How do you now address the systemic issue in our world already and then actually get in there and help with the prevention and these models that you created? I'm really excited to hear about it.
Yeah, I wish I could say I came at it from that lens, Kim, because a first thought for me was there's got to be information, research, scientific literature out there that tells us exactly what's effective in this, and then we're just not using it. So I came from the lens of, there is information and tools out there. We just need to figure out how to apply it. I didn't until I finished that research think about, well, how are we going to get this into systems? And if I had, I think I probably would have come at it a very different way. And I would have come at it from a more social work mentality, which is start where people are at. But instead, we came up with this, absolute best practice, ideal world solution, and then had to figure out well, how are we going to work this into systems that already exist. And so, yes, those were stumbling blocks and challenges, but came after we decided exactly what we wanted to do, which is kind of cool because then we got this cool moonshot, vision, like blue ocean, no one's doing this. But that comes with the added challenges of, okay, well, now we not only need to convince people. And then I'm not talking about the clinicians that are listening. I'm talking about convincing the administrative system, folks that are deciding on these things, that number one, this is important. Number two, it will give them a good return on their investment because, of course, they have those economic barriers as well. And then, two, what is it and how does it work? So, yes, we did figure all that out eventually, but it took a while.
Yes, I love that. I mean, and it's with any innovation, really. I mean, that breaks the system or that it goes against what the system is. You're going to run up against resistance, like AI, coming into the mental health field. There is a lot of resistance around it, when it's clearly very beneficial in a lot of ways. So I just really feel your pain with this. It's like, okay, you've got this great idea. And of course, it's so obvious when you think about it. Of course, we start with prevention, that's the key. But implementing it and getting it in place is a whole other story. Yeah. Amazing. So tell us the journey and how you came up with your model and what your model is. And I just want to talk about all of it.
There's so many pieces of this, right, that you're asking, like what sort of started all of this for me, kicked it off, and then what was our journey, which is, quite long. I'll try to shorten that. And then where are we at? What does this actually do now? So the start of this, I had this preventive internship. If we go all the way back to my MSW days, right, in the graduate school, I kind of begged for this internship that I received because I was on the therapeutic behavioral foster care team where we were going in and supporting parents and children in foster care in really a behavioral therapy approach. And I had been well trained in this before my master's, and so they gave me an internship doing basically what I was already doing.
Oh, nice.
At another level. But I really wanted to do the preventive work. I was super interested in it. So I was like, can I do my next year? Because I had to do 2 practicums in my graduate studies. And can I do my next year in prevention, please? I really want to work in prevention. So I finally convinced them, and I think it was because I also wrote a grant for them for one of my courses that got them a lot of money. So I think that
nice.
So it's like a quid pro quo kind of thing. So I got to do this preventive internship, and I was like, wow, this changes everything. We're trying to keep families together and understand mental health and well-being, and this was also with comorbid neurodevelopmental disorders population and medical problems. So these were fragile populations, vulnerable populations at risk of foster care. And now you're working with the families that are still intact. The amount of progress we made using the same techniques earlier and being able to work systemically, it was amazing what we were able to accomplish and how happy and grateful and supportive these families were, which was not always the experience we had working in foster care. It was very stressful and very overwhelming. And I think we see this in our clinical practices. I saw this when I worked in education. It's just the tension when things are at the crisis level from all sorts of layers of the system, from the family system to the organizational system and all the educational, all of these things. So we just had so many more inroads. And so I just kept reflecting on that. But there was an incident, actually, a very terrible incident that happened that caused me to want to do this again. So I was working in education with a very similar population at this time. So this was back in 2015, maybe. So about 10 years ago in this inception of this idea, I had been working in this education setting with children who had social, behavioral, emotional needs, a variety of diagnoses in that kind of continuum from autism to ADHD, childhood schizophrenia, and so on. So we had this population of students, and I was the clinical director for a while, and then I was pregnant with my first child at the time. And I had this really great rapport with this student who would oftentimes have a very, very big emotional outburst that would be very violent. So I stepped into this interaction to de-escalate, and something was triggered by my pregnancy, by the moment, by my positioning. I was in the wrong position. Whatever I did incorrectly at the time, and he kicked my stomach. So now,
my gosh.
right, okay, all right, that's okay. the child's fine. My stomach was, everything was great afterwards. But in the moment, it was very distressing. I literally took a step back. This student is feeling, later very remorseful, and we're all processing this over the next few days. But it caused me to rethink the entire lens of what we were doing, which was really incredible because you don't get those moments very often. Sometimes like highly triggering moments can get you to think differently. And so we, after processing and everyone's, decompressing, I went back to the concept of prevention and I said, okay, well, what if we came at this through a preventive lens too? What if instead of what we were always talking about is how do we de-escalate? How do we create safe environments? How do we support these students, individual needs? How do we create individual plans that are effective? How can we reduce symptoms, right? All the good stuff that we talk about, all the time, even in individual private practice, right? And instead we said, okay, how can we condition the environment differently? What if we were to change the way we would do things, the policies, everyday practices? What if we were to come at individual problems from the lens of a system and really look at this differently? Because my role had to change. I couldn't just keep getting involved and just being, really, plus clearly I was, not my best.
You were vulnerable.
Oh yeah. I wasn't at my best. So I can't tell you how amazing this transformation was. So a couple months I was there, we kind of practiced and thought of this. I went on maternity leave for a couple months, came back, implemented this with the new academic year. We went from 7 crisis incidents a day. We used pink slips, them.
Yeah.
7 the following year. 7.
Whoa.
Total.
Oh my God. I just got goosebumps. Like, really.
It was, and this was before the science and everything that I'll tell you about, but it was just changing the mentality. Now, I know I had a great system structure because I had trust from the team and they wanted to support me. I wanted to support them and things were working. And so when you have good momentum, right, and you're internal and I was the decision maker, right? So I know I had all these privileges in place. And so it just proved in just a little anecdotal way that we could do things differently, even in population health with people who already have high levels of mental health need, never mind prior to. So I was like, we have a great opportunity here.
That is incredible. Yes. Being able to look at the whole system I'm sure since you've developed this model that helps you look at all systems this way, I'm guessing, which is incredible. It just makes me think of my, years as a substance abuse therapist working in IOPs. And we always would do the relapse prevention plan and that sort of thing to try to, identify anything that could be changed in the lifestyle to prevent a potential relapse and the warning signs and all of that stuff. So hearing you talk, it's just like bringing back those memories. Like we tried so hard to prevent the relapses, if only we could have prevented it before they even became addicted, that would have been amazing. But who does that stuff beforehand? Because you never think you're going to become addicted. But yeah. So you're just making me think of those days back then. So what happened next? Did this happen? You had this case study, and then I guess did it prompt this research and this program and your method?
I would love to say it did. I chickened out.
You're like, no.
Short answer is
you would think.
Out. I was like, okay. Well, we moved back to New York the next year, and we had such success. So we transitioned 16 students back to public school the following year because of that. This was a specialized program. There were so many good things with this, right? And so we moved back to New York to get support with childcare and all this stuff. Now I've got 2 little ones at this time. And I took on this big role instead of doing this dream, right? And so it was a really important part of the journey because what I was doing was leading a system level integration through 3 boroughs of New York City. It was a brand new program. No one really knew how this was going to roll out. I had a lot of autonomy in being able to build and design and develop and put this out there. And it just taught me everything I needed to know about how to broaden the scope of this, small idea into something bigger. And then I chickened out again and scaled an integrative mental health practice here on Long Island, thinking about different disciplines and how we can pull that in. So for everything from acupuncture to yoga and all of that into a very therapeutic and clinical setting. And then I finally stepped out and was like, I'm ready to go and do this. And that taught me all the things I needed to know about running a big company. I think I just needed more than just the clinical background to be able to do it and really be able to navigate sort of like bigger infrastructure working settings, and then also be able to learn all the inner workings of running a business. And so that really prepared me. So when I did launch into the research, I had a sense of what this could be.
That's amazing. I hear this over and over again on this podcast. It's, you kind of almost got to go through all of that to get to the place where you can create this amazing thing, and it's easy in hindsight to say, well, I should have realized it then, but how could you? You have to have all these stepping stones to get to this place where you are now with what you created, right?
Yeah. I wish I had the insight to know those are the skills that I needed, because then, you can go and develop those things. So hopefully someone who has a really great idea that's listening is like, well, I can just go develop those business skills.
I love that.
Spend 2 years in a setting.
Prevention.
Right. Exactly.
We're preventing them from having to go through all of that to get there.
This proactive lens is always on now. Right. Exactly.
I love that. Yeah. I love that. Yes. So tell us about your model and your research and what it's all about. I'd love to hear the details.
Yeah. So when I set out, it was really just to identify, okay, what are these preventive factors? We know the symptoms. We have the DSM. We can have a whole debate about that at some point. But what are the things that make up good mental health? What are the factors that condition psychological health, which is now we talk about it as all the time? And what are the things that are protective factors that buffer against the everyday stress, adversity, hardship, challenges, traumas, and things that we may experience that would equip us with better coping skills such that we could reduce our risk, right? And so I didn't go in with that exact lens. I went into the research just coding and understanding what is the research telling us. I don't have a research background, so throughout this process, I'm leaning on researchers to guide me, teach me what a thematic analysis, teach me how to do it, teach me what I'm doing wrong. I just started cold outreaching to network connections. I'm calling, professors at Fordham, my alma mater, and I'm saying, hey, can you help me with this? I've got this project going. So I just became really good at just asking people for advice. And I got in touch with all these researchers who were really interested in work like this. And that gave me a little cohort of folks. And I'm the only applied researcher on that, right? They're all the analytical folks. So anyway, we were able to get these factors and distill this research down into key factors, which I call them now, and then categorize them by what we call 5 elements. And it's just one way of understanding these psychological health factors and these protective factors. And, people will compare it sometimes to Maslow's hierarchy of needs and say well, there's little pieces of this. What we did was say, okay, well, 1, we need recent research, and 2, we need to understand what is measurable. Because if we just have these factors, how are we going to figure out if they're present in an individual or a population or not? And where do we need to strengthen these things? So when we saw the pattern of the psychological health versus basically internal versus external factors, we were able to say, okay, great. Well, if we strengthen these external factors, these internal factors should improve. Let's test that theory. Started with really understanding what those factors were, figuring out a way to measure them, measuring them and seeing if that the thread really worked the way that I thought it would in terms of that theory of impact that I wanted.
Yes. Now, how many factors are we talking about? 40 or 5 main core ones? Just curious about that.
We broke it down to 30 factors of psychological health and 30 factors within the protective factors framework. So there are 60 total factors that we're looking at, and both within these 5 elements. And that way we can say within, for example, the secure factor, which looks at psychological safety, emotional security, things on the external side like belonging and equity and reliability and protection and all that good stuff. And then on the internal side, like self-awareness and belief systems, right? All that make up that secure sense of self. We're able to then look and to see, does conditioning this improve this? And that's been super, super cool for us over time.
So what have you found? What are the...
Well, so that was
what works?
Right. So it was okay, well, this is not good enough. We can't just hand people a survey tool and give them their results and say good luck, because that was the whole problem with data to action if I gave you a bunch of data today for the population you serve, or let's say a population you have served in the past, there's no time to analyze, interpret, apply all of this, really in these programs. At least that's what we've heard in a lot of these interviews. So what we decided to do is like, okay, well, we can't just give people data. We have to give them a full way of evaluating this and changing factors. So that's where the equip model comes in. So what we took all the guidelines you've been given over the course of your professional, anyone who's worked as like a director of anything, you've been handed a 42-page guideline at some point. I always say 42 pages because they're all like over 40 pages, and then told like, these are best practices, right? So we took all the guidelines from CDC, MHA, WHO, all the things, NAMI, and took them all and put them into a sort of best practice model of systems change. We looked at, system thinking, design thinking, because if we're conditioning environments, we need to design them in a certain way. We looked at, so if we're coming at this from a proactive and positive lens, we need to come at this from a appreciative inquiry standpoint. So rather than to ask about all of these pain points and negatives, we need to be asking about where the strengths are and how to replicate them. So we dug deep, and then we outlined that into what's the equip model, and it stands for examine vulnerabilities, E for examine, Q for quantify. That's where our surveys come in. So we get our quantitative data. A U for unite. So we're pulling in stakeholders because, when you have not been involved in decisions at the systems level and they come down to you and you are very confused and you wonder if they thought about how you were going to implement them. This is why we're right.
Yes, good point. It's like, you want me to do what? What is this?
What?
Yeah.
I don't think you know how this works. Inquire diverse perspectives. So having diverse stakeholders from a representative part of that population that we just gathered. Answer these qualitative questions so we can understand how this data that we just gathered actually is experienced in real life. And that's after we've got this goal that's created from the data. And then the planning phase, which is basically a 3-phase kind of scaffolded best practice and systems change approach. So that's the equip model. So then we tested that for a year. We've done everything for a year. And then we designed a software tool that can automate the entire thing. Analyze and interpret all the qualitative data, help you with the contextual analysis to understand what's already going on, code everything for you, and produce an automated strategic plan. So it takes all the heavy lifting off so we can focus on, okay, we've got to implement this strategically. We get to be creative, and we get to look at this from the lens of proactive, which is so fun and interesting and an exciting part of the work that we haven't really focused on. So that's the journey.
That's so interesting. Oh my gosh. So you create the software, and then like, who is the user? Are we talking like corporate? Are we talking about like community mental health agencies? Like, I feel like anybody could benefit from this really, if you're like giving it to your employees in a corporation, or for like EAP type stuff, or even at the community mental health level.
Yeah. So we've tested it out in all those 3 spaces and education. So we tested it out in public education. We've tested it out in colleges and universities, from community colleges to the larger universities. We tested it out as a healthcare workforce opportunity, because as healthcare providers, we tend to have the highest rates of stress-related problems. And so being able to support that workforce is really important to us. And we haven't really spent too much time in the corporate workforce because we're focused on these populations. So, we could be industry agnostic, but if we look at statistics and we say, okay, well, the majority of folks with a diagnosis of a mental or behavioral health disorder is between 14 and 24, then we really need to be focusing our prevention efforts really, really early on. So certainly the workforce is a highly triggering and stressful environment, especially for healthcare providers. And so that's where we want to work there. But education is a great place for us because we can support the entire population. We have a population that has shared characteristics and a shared environment. And so that gives us a sense, a place to be on campuses and in schools, and then community organizations we're working with as well. So for example, a community organization, A Moment of Magic, that serves childhood cancer survivors and their families, they put their focus on mental well-being of this population. Of course, there's high level of stress and triggers and things that they're dealing with. And so we've worked really closely with them to evaluate their population's needs and define a specific goal. And so we do both their workforce population and their population health. So yeah, it's been really, really great and fun work to launch this.
Oh my gosh, it's so interesting. I'm just thinking about all the ways you're probably using it. It's got to be amazing. So you'll bring it in, I guess, and like survey a sampling of the population, like in the school system or something, and get some results. And then based on your model, I guess, implement these are the systems that you could put into place now to help with these preventative things that we found are super helpful and help with the vulnerable populations that you're dealing with and help like prevent things that could come about later because we're implementing this stuff now in the system.
Yeah, right. So in the examine vulnerability stage, we're looking at risk factors. So in each population, we have a different set of risk conditions. We've taken all the, research on risk. So things like childhood abuse and neglect, parental mental illness, cognitive disabilities, those kinds of factors, right? Financial and economic hardship, discrimination bias, right? All the risk factors that we know condition poor mental health. So we analyze that. That gives us a sense of who is most vulnerable within the population. Then, since we're analyzing the protective factors, we say, okay, where can we have the biggest impact? And then where are those psychological health factors low? And so we look at the biggest gap between those to strengthen. That identifies a predictive goal. We look at those risk factors. We pair that with evidence-based solutions. And then those solutions are within what we call 4 Ps. So at the systems level, instead of specific interventions at the individual level, we're talking about 4 Ps. Policies. So are there policies around this? What do the policies say? How could those policies be improved? Practices. So what are the everyday practices within this environment? So if we're talking about a healthcare environment from inpatient, outpatient, right? There's different conditions of those environments, different practices. How do those condition that key factor that we're trying to improve? Where are those gaps? How does it impact this most vulnerable population, right? So we're making all those connections. We do use some AI, but we also use consultation to bring in more research and support around how to do this. So policies, practices, programs. So there's programming that we're all using to try to strengthen well-being in certain ways. What is that programming doing? How can we infuse this specific protective factor into that programming if it's not already? How can we increase engagement in that programming? All that kind of stuff. Fidelity is not enough, right? And then places, the last one, which is what does the environment actually look like, feel like? And there's so much interesting research like environmental design in inpatient settings, right? That you can see the difference in how people respond to a beamer versus a medical chair, right? And just little tiny bits of, environmental design pieces. And same with the schools, right? So creating calming spaces, what do those spaces look like? Just including plants, live plants in a room, right? Access to natural light, like simple things sometimes are also really, really effective. So depending on what that key factor is, if we're talking about regulation and access to natural light, it's very different than if we're talking about a reliable environment. Do people do the things that they say they're going to do?
Yes, yeah, because as you're talking, I'm sitting here thinking, like, I want to know the use case, like the cases, like what have you guys actually implemented in these systems? And I love hearing that, the plants, the natural light, like it makes so much sense when you say it. Like, of course, instead of those awful fluorescent lights with no windows in a room and, those hard plastic chairs, that kind of thing, like it probably makes such a difference.
Yeah, it really does. There's this really interesting project we did. Some of the feedback we got was that the classrooms that were really, really far down this one hallway had better outcomes when it came to this stimuli factor that came up. So emotional regulation to stimuli. So that's light, sounds, all that kind of stuff, which we kind of take for granted that we can cope with. But, kids are coping with a lot in these schools. And we found that like the classrooms at the end are reporting they're just fine. And the classrooms in the middle of the hallway are really very overwhelming. And we realized, and so we just sat in the hallway for a whole day. I just parked a chair and I did my work there. And I just noticed that super loud. And who's like running in from PE and who's coming down the hallway for their speech therapy session and they're chatting and it's super loud. And so we realized like, oh, wow, this environment is super busy, this section of the hallway. So we looked at some environmental design and we saw like, there was no moving space in this building. There wasn't ability to like shift classrooms and like move kids around. So we had the art team create these noise buffering art panels where we stuffed them with this noise buffering, and then we put the art panels on the outside and had them design these beautiful things and hung them from the ceiling. And so as they walk through the hallway, it would catch the noise and buffer against the sound. And these classrooms were much more quiet. Included this school, got people engaged, got people understanding what we were doing, why we were doing, got people excited about it, involved in the change. Everyone was on board. And it wasn't a long project, right? But it changed, significantly improved their regulation when it came to stimuli in terms of noise.
What an amazing thing you all are doing. I mean, that is incredible. Like, who would think? Who would think of that, you know? Like, especially that you go and actually sit and not just like speculate. Oh, maybe it's, maybe it's too noisy. You actually went and sat in the environment and took it all in and then used your model to apply it to like, how can we like implement this in real life to make a difference? Yeah.
And that's how these 3 stages of the planning came to be, because we said, okay, well, first we have to like go and, it's a basic sort of public health model, right? So you go and figure out what's going on first. So this is what we call the grounding phase. Go and figure out, ask questions, experience the environment. And now, of course, we're having the project leads in these settings go do that work because we want them to be seen as the experts, right? And we can guide from the back end from a true like social work method that we don't want to become, we don't want them to become dependent on us. So they're going in and experiencing these things and realizing so much about their own spaces and environments and changing the way that they think. So on one college campus, we're working on reliability, and another college campus, we're working on power. So the shared power came up as a problem. And so they're looking at these environments very, very differently and just giving us, so like from a grounding phase, like looking and experiencing it, to a relief phase, which is testing it out in small ways. Like, what if we do it right here? And then the shift phase is like, what's sustainable, scalable, something that we can sustain over time and easy to sustain rather than to invest a lot of resources in this over time.
I'm just thinking, I'm hoping people listening to this episode, even like solo therapists in private practice, are getting some ideas around even their own environment and how they're presenting, even telehealth. I mean, there's different ways to make that better for people and make it more accessible. And the prevention piece, like making an easier transition into seeing the client and onboarding the client, just all of that, just even for the solo practitioner, I bet it's going to be generating some ideas for people listening.
Yeah, well, we've done this. I've used these survey tools with my own patients in private practice, and it is amazing to look at it from this lens and give them a sense of their strengths and needs from this lens too. So it opens up a lot of doors from a therapeutic lens, especially at the start of therapy and the close of therapy, because oftentimes we're transitioning out to almost nothing because there's not a lot of step down resources, right? From besides maybe some support groups or, continuing in the social structures that we have worked on, maybe perhaps, or family structures that we've worked on. But this gives a sense of like, okay, this is where we can strengthen, and it gives a little bit of a transition plan. So I've been using it in that way. And then from a group practice standpoint, what's really cool is that you can look at the whole dashboard and say, this is where our population, and there are common characteristics because often these group practices live and work in the same area when it's in person. And then from a telehealth standpoint, right, we're oftentimes trying to get a broad look at where we can strengthen things and how we can improve, and it's more complex. And so having data to inform those decisions and having best practices at our fingertips so we can improve that entire system of telehealth care is going to be really important, even if it's not our tool, right? Just from the nature of running a telehealth practice.
Yes.
Yeah,
especially working with kids or something. If you're trying to be telehealth and work with younger populations, that's a real challenge. So are there tips for like the solo practitioner that you could give? A couple of tips just from everything you've researched and learned that the solo practitioner can maybe just take away from this conversation?
Wow. I want to think of something practical that's not, overly complex. What we found helpful for individual folks that are looking at our model is to go and take the survey for free. It's on our website, mindarchealth.com. And just taking the survey, we found gives people a new lens of thinking about mental health from a positive standpoint, because you're like, oh, these are the factors they're measuring. These are the things that condition good mental health. They're going to be obvious to all the clinicians on here once you take it, but it does give you that lens. And then also on our website is a description of each of the 5 elements, which gives you a sense of, okay, what does the secure factor mean? What does regulated mean? What does valued mean? Decided, related? How can I think about my patients' care from these perspectives in addition to the modalities that I'm using to reduce symptoms and improve functioning? Because oftentimes when we're talking about improving functioning, we're talking about a few things: sleep, nutrition. At least this is where I was coming from before all of this research, right? Like sleep, nutrition, exercise, mindfulness, things like that, in addition to reducing symptoms and improving, as a way of improving functioning. We're looking at socialization. But within those categories, there are some really specific key factors. And so just looking at the 5 elements can help kind of broaden that scope a little bit. I love that those like physiological features are part of our lens a lot of times, but there are other things. And I found that especially with patients who are, having post-traumatic stress symptoms, for example, the secure factor is really important, and the regulated factor. Oftentimes, so where are those things coming in? And you can start to see how those interplay. You can have them take the survey for free, and they can just share their results, right? It's anonymous, but they can print their result and they could bring it to the therapist and share it. So anytime you want to send a patient to fill out the survey and then just have them bring it to you. And then we're developing slowly an app people will be able to use and store their results, and then have access to the surveys for free, and also be able to do a risk assessment on those factors I was talking about. They're a little bit more sensitive questions, of course, because we're talking about history. And so we're, being cautious about that.
This is really cool. I can't wait to go to your website and check it out. I'm guessing you all do consultations for anybody that would want them, like a group practice setting or school settings, that sort of thing.
Yeah, so we've just started scaling this, right? So we were just really wanting to cautiously make sure that this was effective, feasible, adoptable, and we've proven all of that. And so as we're scaling, we're taking on some new populations now. And so if people are interested in talking through it more, I'm happy to share more. Reach out to me directly. We're a small company, so they can just reach out directly and we can talk through what they're looking for.
Amazing. And yes, of course, to the listeners, we'll put all this down in the show notes so you can find her really easily. Thank you so much, Nadine. This has been so fascinating. Really.
Yeah, I love it. And can I ask one thing too of listeners?
Yes.
What really helps us is to be able to follow all of their voices as well, because we take all of these tiny little nuggets and then we'll do some research on them and pull them into our practices and solutions. And so, if you follow me or connect with me on LinkedIn, then I can follow the work that all of you are doing. And that would be really amazing for us, because, our team is always looking to strengthen our knowledge of what people are doing. So even from, a more downstream treatment lens, because that influences what we're working on in prevention from a primary prevention standpoint.
That makes so much sense. And did they just find you under your name on LinkedIn, Nadine Wilches?
Yes. Yeah. I think it's linkedin.com/in/N Wilches, but that's a bit of a mouthful. But yes, I think I'm the first one that comes up.
Oh my gosh. So interesting what you're doing. You're making such an impact in the world, and I think it's amazing. Yeah.
Well, thank you for having me, Kim. This is a really nice time. I love that what you're doing at Berries. You're also having this sort of super innovative and exciting time in your company's growth too. Yes. So I'm celebrating everything that you're all doing and happy to stay connected and support your work too.
Yes. Thank you so much. I'm definitely just going to go make sure I'm following you on LinkedIn. Keep track of what you're up to. Yeah. Thanks a lot.